Mr. Majewski's Anatomy 32 class lecture, Chapter 11, Part 5, Muscles of the Lower Axial Skeleton. So, as we continue on talking about muscles that can move the vertebral column, we can now look at the Intercostals thoracis. Intercostus thoracis, Intercostus ribs. Together on each side, if they constrict, then you will get extension of the vertebral column, but normally they are used to maintain erect posture of the thoracic vertebral column. Then you get the semi-spineless thoracis right here. This muscle, when acting together, can extend the vertebral column. Singly, it can help to rotate the head and the body side to side, opposite of where the contraction is occurring. Then you have the spineless thoracis, right along the spines of the vertebral column. And together, they can extend the thoracic vertebral column. And then you have the longissimus thoracis, right here. And together, when acting together, it can extend the thoracic vertebral column. Acting singly, can laterally flex the vertebral column in the thoracic area. Then, going a little lower, we have the quadratus lumborum right here. Together, it acts to extend the lumbar portion of the vertebral column, and singly, it can laterally flex the vertebral column. And then we have the Intercostals lumborum, so it's going all the way up to the ribs, down to the lumbar area. And together, it can extend and maintain the erect posture of the lumbar vertebral column. So here again, you can see some of the splenius capitis, the semi-splenius capitis from the last part of the lecture. Thoracic, semi-spineless thoracis. You've got the spineless thoracis. You've got the longissimus thoracis, the Intercostals thoracis that actually flows down into the Intercostals lumborum. All right, well, those are all extending the vertebral column. Now we need to flex the vertebral column. To do that, one important muscle is the Rectus abdominis. It can help to flex the vertebral column, and it also can compress the abdomen, which can aid in defecation, urination, forced exhalation, and childbirth. Its origin is down here in the pubic crest and pubic symphysis, and its insertion is the cartilage for the ribs 5 through 7, as well as the xiphoid process of the sternum. And then we have the external obliques, that would be on either side. Together, they act to compress the abdomen and to flex the vertebral column. Singly, they can laterally flex and rotate the vertebral column. Their origin is ribs 5 through 12, and their insertion is the iliac crest and linea albina. So what are some of these cartilaginous structures we see here associated with these muscles? Well, the linea alba is the midline fusion of the 3 aponeuroses of both the external oblique, internal oblique, and transverse oblique. You can see here the aponeurosis of the external oblique. These lines going across the rectus abdominis are the tendinous intersections, and they attach to the rectus sheaths of the rectus abdominis, and they are actually what helps form the borders of the six-pack for people who are able to work out and get those. And then the rectus sheaths here around the rectus abdominis is formed again by the aponeurosis of the external and internal obliques and the transverse abdominis, and they surround the rectus abdominis. And then down here at the posterior end, we have the inguinal ligament, which is the inferior edge of the external obliques aponeurosis. Actions. Now we've got the internal oblique, deep to the external oblique, and then the transverse abdominis, which is deep to the internal oblique. The internal oblique acting together can compress the abdomen, as well as flex the vertebral column. And singly, It can laterally flex and rotate the vertebral column. Its origin is the iliac crest and inguinal ligaments, and its insertion is the cartilage of the ribs 7 through 10, up here, and the linea albina. So its direction is different from that of the external oblique. And then the transverse abdominis can compress the abdomen. And its origin is the iliac crest, the inguinal ligament, and the cartilage of ribs 5 through 10. And its insertion is the xiphoid process and linea alba and pubis area. So these three muscles layered on top of each other actually orient their fascicles and in 3 different directions. Now, muscles that help in breathing. Well, we have the external intercostals, as seen here. And they contract to elevate the ribs, leading to helping in the normal inhalation of air. Their origin is the interior border of the rib above, so up here, and their insertion is the superior border of the, that should be inferior, of the rib below. Then we have the internal intercostals, which are deep to the external intercostals. The internal intercostals contract to draw the adjacent ribs together, thereby acting in forced exhalation. External inhalation, internal exhalation. Their origin is the superior border of the rib above, and their insertion is the inferior border of the rib below. Oh, I said that backwards. Their origin is the superior border of the rib below, and their insertion is the inferior border of the rib above. Sorry for the typos. All right, the most important muscle for breathing is the diaphragm, this huge muscle that also forms the border between the thoracic cavity and the abdominal cavity. And the diaphragm contracts to lead to normal inhalation, and when it relaxes, this leads to normal exhalation. Its origin is huge. It's the xiphoid process going around through the cartilage and bones of ribs 7 through 12, and the lumbar vertebrae and their intervertebral discs all the way around. Makes a huge circle for its origin, and then its insertion is right here in what's called the central tendon. So, for breathing, we've got the external intercostals and the diaphragm. Forced exhalation, we have the internal intercostals. Here's the quadratus lumborum, the transverse abdominis, the rectus abdominis, the internal oblique, the external oblique. You can sort of see all the pieces starting to fit together. All right, the muscles support the pelvic region. So, the floor of the pelvic cavity has quite a few muscles there to hold up our guts. For instance, we have the levator ani here. It's actually 2 muscles. It helps to support and maintain the position of the pelvic viscera, our guts. It resists increased inter-abdominal pressure, such as when we're coughing, urinating, defecating, so forth. It can help constrict the anus and the urethra and vagina. We have the ischiococcygeius here. It helps to support and maintain positions of the pelvic viscera. Again, we don't want our guts squishing out. It resists the intra-abdominal pressures from coughing, urination, etc. And also it can pull the coccyx anteriorly during childbirth and also following defecation. We have the superficial transverse perineal muscle. It stabilizes and supports the pelvic floor. We have the ischiocavernosus muscle that maintains clitoral and penile erections. We have the bulbus spongiosus muscle, which helps to expel urine, also assists in clitoral and penile erections, and helps propel semen along the urethra. And then we have the external anal sphincter that keeps the anal canal and anus closed. Oh, look, here's the gluteus maximus. And then we also have the external urethral sphincter, which expels the last drop of urine or semen and otherwise keeps it closed. All right, here's just showing the difference between a male and female pelvic region, and you can see that while some muscles look pretty much the same in both cases, others have slightly different positions, such as the boviospongiostis goes partially up the shaft of the penis, while in the female it goes around the vaginal and urethral openings. Going deep, we also see that there is the deep transverse perineal muscle that also helps to expel last drop of urine and semen. And here's just another picture with a cadaver. Here's the boviospongiosum running along the shaft. You get the deep transverse perineal muscles here. You've got the superficial transverse perineal muscles here. You have the external anal sphincter, ischio-coccygeal, the levator ani. Disorders of the muscular system. Well, one disorder is Bell's palsy. This is a facial paralysis, which can lead to unilateral paralysis of facial muscles of the facial expression. So it can affect basically one side of a person's face. So in this case, this guy is trying to smile all nice and big, but one side of his face is unable to do that. Strabismus, which is a condition in which the two eyeballs are no longer properly aligned. This is called lazy eye. So if one of the muscles causing the movement of the eye is not functioning properly, for instance, its nerve may be cut, then that could cause lazy eye. Dysphagia is the clinical term for difficulty in swallowing. Always a very serious condition. You can have an Guino hernia, which is a rupture or separation of the inguinal region of the abdominal wall. Basically, you've got that inguinal canal going through the inguinal ligament, and basically the small intestines start to protrude through that inguinal canal. This is more common in men than women because the men's inguinal canal is larger, because A, men are bigger, and B, because it also has the spermatic cord go through it. And then urinary stress incontinence. This is when you get leakage of urine whenever intra-abdominal pressure occurs, such as laughing, coughing, and so forth. You have the rotary cuff injury, which is a strain or tear in the rotary cuff muscles from vigorous circumduction at the shoulders. You got golfer's elbow, which is a condition caused by a strain of the flexor muscles from repetitive motions, often with golfing, and this means the muscles getting stressed that attach to the medial epicondyle of the humerus. A groin pull is a rupture of or tear of muscles in the thigh that move the legs medially or adduct them. Pulled hamstrings, obviously a strain or tear on the hamstring muscles. And the shin splint syndrome, where you have pain or soreness along the tibia. This can be caused by tendinitis, inflammation of the periosteum, or stress fractures in the tibia. And that's it for chapter 11.